After fleeing their homes in the Democratic Republic of Congo, many Congolese refugees in Rwamwanja settlement, Kamwenge district, struggle to cope with their new environment, leading some to attempt suicide. However, this is a story of resilience and hope, focusing on the Congolese women who survived the suicide attempt and have since rebuilt their lives.
In the year 2021, a surge in suicide cases sent a shockwaves in Rwamwanja refugee settlement in Kamwenge district, with a total number of 59 cases and 11 deaths. In 2022 alone, 41 cases were registered, with 12 deaths reported. Among those were children below the age of 15 years.
Sasa tulifika hapa maisha ikatupiga sasa.
So when we reached here, life mistreated us.
Tukakumbuka pia kwetu Kongo.
So we remembered what we left in Congo.
Tukasema kweli humu tutaweza humu na humu.
We're going to manage life in Uganda.
Tuko na watoto lakini hali ya humu.
Suicide has been one of the growing challenges here in Rwamwanja refugee settlement, and over the years, as TPO Uganda under the UNHCR funded project, we've been responding to suicide and leading in the suicide response and prevention in the settlement. So by doing that, we reach out to the communities, and we start with awareness creation, teaching the communities what are the warning signs.
The suicide case is said to have been due to the depression, trauma, and poverty, among others. In Kaihura D-Cell, Rwamwanja refugee settlement, I encountered the Songa Mbere and Umoja Ninguvu women's group who were struggling to cope with the trauma and depression resulting from the war.
Tufundisha gisi mtu anapasha sababu juu tulikuwa tunaanza juliza.
Because some of us we could live well in our country, but when we were brought to Uganda, things were tough because we could sleep in bad houses, even we have small piece of land. So that life was confusing.
Male lead in attempts, and male the most of the death by suicide under male have domestic violence coming in as the second leading trigger for suicide. Most of the cases have domestic violence coming in behind there.
Despite the resilience and efforts to rebuild their lives, some members of the group had attempted to take their own lives to the devastating impact of war on mental health. TPO Uganda, with funding from United Nations High Commission for Refugees, to step in to provide mental health and psychosocial support to refugees in Rwamwanja settlement in Kamwenge district.
TPO Uganda, with funding from UNHCR, has been helping displaced and stateless persons in Rwamwanja refugee settlement through a project called Provision of Mental Health and Psychosocial Support Services. Under these services, TPO has been doing a number of interventions. Among them, we have an intervention which handles people's problems which originate from the thoughts.
Since 2021, TPO Uganda have reached over 12,000 refugees through a combination of group and individual-based interventions.
In 2021, we had a suicide surge in 2021, and that's when UNHCR brought us on board with their funding, which has really supported the people, and we try to mentor these people into that information. How do I identify? How do I, whom do I tell if I find such and such a person?
The Songa Mbere and Umoja Ninguvu women groups in Rwamwanja settlement, once struggling to cope with the trauma of war, have now found a path to healing and rebuilding their lives. Haruna Mtesasira.